and balance the immune system. This is very important, especially if a child experiences an adverse reaction to a vaccine. Another ancient remedy that's been used for centuries as a method of providing natural immunity is essential oils. Here's Dr. Eric Zielinski describing how essential oils were even used to combat the bubonic plague.
It's an unbelievable story about taking oils like cinnamon, clove, eucalyptus, lemon, rosemary together and combining them in such a way where the vapors actually themselves combat the volatile organic compounds from the plague, from the virus. We actually see research, a very similar blend was researched recently, a clinical trial that actually shows it kills the flu virus. Just flat out, it kills. And again, clove, cinnamon, eucalyptus, rosemary, cinnamon, you all work together. It's a synergy. It's a synergistic effect, and they combat viruses. I found this 1911 book from the Carnegie Library that started talking about essential oils with everything from pertussis, whooping cough, and pneumonia, and just infectious disease. In the early 20th century, that's all that they used. I mean, that's what they used. In World War I, World War II, they were using oregano in time to combat gangrene and infection on the battlefield. So what happened? Well, we look at it, well, antibiotic happened. And the government and Big Pharma said, look, we got a solution. And it's cleaner, you don't have to smell like pizza, and it's very simple, and it's cheap. Take a pill. And so people are like, okay, makes sense. Well, that changed the paradigm. When the antibiotics came out, that changed the whole paradigm. That's the reason why we're in the situation that we're in today, if you look at it historically. And that was the medicine, especially European doctors. You know, Dr. Valnet from France, that's what they used. And so aromatherapy wasn't, quote, invented until the early 20th century, when Rene Gadefus burned his hand in a laboratory experiment. And the story goes, he was just frantic, looking for something to help relieve his hand, and he saw a big vat of oil. He put his hand in there, it was lavender oil, just to help relieve it. He would have put it in anything. He was surprised at how quickly it healed and how there was no scarring. He's like, what in the world, what was that? They were just experimenting with lavender oil. Well, it allowed him, it really opened up his eyes to look at the healing properties of lavender and other things, and that's where he wrote a book called Aromatherapy. And that was a French book. That's where we know what we do today based off of his studies now 100 years ago. Aromatherapy is the usage of it, the therapeutic use of essential oils. And there are 3 different ways you can use essential oils. Aromatically, and that is through a diffuser. You can apply them in a nebulizer or an inhaler, you know, like a steam sauna with eucalyptus, perfect. Also a topical. You can apply essential oils topically, or you can ingest them, which is a debated topic, but if done safely and wisely, it's very effective. Got some stuff on pneumonia too, because essential oils have been shown, thymol, carvacrol, geraniol, citronellol, these are the chemicals in oils like lemongrass, oregano, thyme, yeah, and thymol, thyme, geraniol, rose. These are oils that have been proven to kill pneumonia. So what we see with whooping cough specifically is going back to the research that we see in 1911. They were using they were injecting a 20% dilution in almond oil. So they had sweet almond oil and a 20% dilution of camphor. I mean, it knocked whooping cough in its pants. So camphor also is a main chemical in rosemary. So rosemary is a very common oil. And so what that means, folks, if your son or your daughter is battling whooping cough, even using it aromatically, but again, what's in that blend we talked about? Cinnamon, clove, rosemary, eucalyptus. I mean, they figured out how to kill the bubonic plague. Those oils are also effective against whooping cough as well.
Essential oils are most definitely time-tested medicine, and they help support natural immunity and the entire immune system. Macrophages are important cells of the immune system that are formed in response to an infection or accumulating damaged or dead cells. They're large, specialized cells that recognize and engulf and destroy target cells. Here's Dr. Marco Ruggiero discussing GC-MAF and Rerum and how they can be used to activate macrophages and even treat autism.
GC-MAF is an acronym for GC, globulin-derived macrophage activating factor, MAF.